The following Pharma Essentia podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hey, Josh.
Hi, Kay.
And hello, viewers and listeners. Welcome back to the PV Pod, Stories from the Marrow,
A podcast about Polycythemia Vera.
brought to you by Pharma Essentia.
Thanks, Pharma Essentia.
Josh, really quickly, I want to plug an upcoming community event.
Plug away.
Coming up on September 13th in Dallas, Texas, there will be another PV in Focus event. Anyone living with or caring for someone with PV is encouraged to join. Visit pvinfocus.com to register and learn more.
Sounds awesome.
Okay, now, Josh, I am really excited about today's episode.
Oh, great. What do we got?
Our topic today is incredibly important in the rare disease space,
I like the sound of that.
but it also hits really close to home.
Really? What is it?
Today, we're going to be talking about sharing.
Oh, here we go.
The absolute critical importance of sharing, Josh.
Kay's been trying to get me to share my Netflix login for like a month now.
To share is to care, Josh.
Get your own account. You're 28 years old.
That's like being 19 in this economy.
Can we please get into the real topic for today?
Fine. Today's topic really is sharing.
Kay.
No, I'm serious. Today we're talking about shared decision making.
Got it. That has nothing to do with my Netflix login.
Yeah, well, you've been avoiding me outside of the studio.
For good reason. Can we please just talk about shared decision making now? I think I know what it is, right? When you and someone else are making a decision together. But what does that have to do with PV?
Time to bring in the expert.
Oh, great. Who are we talking to today?
So I'm Lucia Masarova from MD Anderson Cancer Center in Houston, Texas, and I'm associate professor and the co-leader of the myeloproliferative neoplasm sessions here in the leukemia department.
Hi, Dr. Masarova. It sounds like she might be the perfect person to talk to about this.
Indeed. Here's a little bit more on her background with PV and MPNs in general.
I have been working on the PV patients or the MPNs ever since I joined MD Anderson Cancer Center, so about 10 years ago. And I've been mentored by one of the greatest in the field. And after his retirement, I actually acquired almost all of his patients for this category. So I think I have a very large patients number that I care weekly. And we have also been quite significantly doing research focused on how to improve various aspects of the management and the disease.
Okay, I need to redact my earlier statement. She is definitely the perfect person to be talking to today. What an extensive experience. Okay, let's get into it. Why did she decide to study MPNs? Where?
Not so fast, Josh.
I'm sorry?
We're not done introducing our guests.
Does that mean, could it be?
Today, we are very lucky to have two guests joining us on the PV Pod.
I'm gobsmacked, Kay. This is going to be a great episode. Who else are we talking to today?
My name is Cheri Clark, and I live in North Carolina, but I call St. Louis, Missouri home. I started my career in healthcare in 1986 when I finished nursing school. I worked for many years in long-term care and rehab, and currently work part-time doing vaccination clinics and corporate health screenings. I've also worked as a medical transcriptionist and have most recently completed some classes in billing and coding. So I've been in healthcare for a long time.
In addition to her extensive medical background, Cheri herself has polycythemia vera.
So today we're getting both the physician and the patient perspective on shared decision making. How fitting. Since it so heavily involves both the physician and the patient, it makes sense that we would need to hear from both sides.
Agreed.
So where do we want to jump in?
I'd like to start with Dr. Masarova. I was curious about her interest in MPNs. Why choose that path? What sets them apart?
Good question, Kay. I can't wait to hear the answer.
So it's a kind of very interesting disease because it doesn't really belong to only oncology. It belongs to oncology, internal medicine, and everything else. Where we have to communicate and collaborate with all kind of different specialists, neurology, rheumatology, just you name it. So that requires much more hands-on work, and it has a different assessments or different goals and importance, and we are focusing a lot of preventing. It's harder in oncology to focus on preventing, where we are not there in most of the cancers. So a lot of the time, I even hear from either my colleagues or patients or different groups, why are we treating diseases that nothing happened to them, that don't even exist sometimes? So, and on the other hand, patients come, they have of course, disease, they have symptoms, and they say, well, nobody listened to me. So that is actually quite of a burden of the.
Gosh, I feel like we talk about this every episode. It's horrible how often people with PV are dismissed. We're starting to sound like a broken record about this.
But that's why it's so important to talk about. The more we discuss this kind of offhand dismissal and how harmful it is, the more people will be aware of it, and then hopefully the less likely it is to happen.
It's helpful for people living with PV who have experienced that dismissal too. I hope us harping on this lets people know they aren't alone and that their complicated feelings around PV are valid and shared.
Really good point.
Did Cheri have this experience when she was diagnosed?
I was diagnosed with a bleeding disorder called von Willebrand disease when I was 40. So I already had a hematologist that I was seeing on a regular basis. And after the elevated labs from my physical came back, was referred back to her, and I made another appointment. So it was that same physician that I had seen for years for my bleeding disorder that actually diagnosed my polycythemia vera.
So Cheri already knew her hematologist and was able to navigate her diagnosis from there.
Got it. Let's get back to Dr. Masarova and her experience with MPNs.
It's more on the mental and bonding and trust and connection with patients, providers, and everybody, because patients live with the diseases quite long, if forever. And contrary to others, the problems and the symptoms just build up. So the longer they live, the more risk they could get. So it's sometimes a little harder to keep that on the ground and keep reminding everybody, like, we may be doing great for the next year or 10, but watch out for the next decade to come, which brings a lot of issues. Of course, social, mental, fear, stress, burdens, financials, and everything. So given that a lot of patients are also younger, that is even worse. So it's kind of all flavored, more complex oncology, internal medicine.
That's a really interesting point. And we've talked about the long haul of living with PV, as well as how PV can change over time and why it's therefore so important to treat it for the long term. It is very complex.
I also like how Dr. Masarova points out the emotional burden of living with the rare disease for a long time. Brings to mind that phrase, you'll die with PV, not from it. It's just so dismissive of all those years of mental burden and potential symptoms and risk of thrombotic events or even progression. I mean, take Cheri's symptoms, for example.
For several months before I was diagnosed with PV, I had intermittent headaches, some facial flushing, and some visual disturbances that I can best describe as rainbow-like lightning bolts, like out of the side vision, rainbow-like lightning bolts is exactly what it looked like.
Distressing and disoriented, to say the least. I can't imagine hearing about symptoms like that, not taking them seriously or neglecting how much of an impact they would have on a patient's life.
That reminds me of someone else being neglected.
Oh, yeah?
Someone who could really use access to a Netflix account.
It sounds like we might need a break.
We'll be right back after this quick break from our sponsor.
So you're learning about PV on the PV Pod, Stories from the Marrow. Now get ready to take the next steps on your PV journey with What's Next PV, an educational site on everything polycythemia vera.
Knowing what's next can help inform the decisions you and your doctor make about the future and is important to your health. What's Next PV can help you understand test results, set goals for the management of your PV, and make a plan to advocate for yourself. Check out www.whatsnextpv.com to learn more. And we're back.
Thanks for sticking around. Okay, I'm ready. Let's get into it. Shared decision making. Where do we start?
I think it would be really helpful for Dr. Masarova to define shared decision making, just so we're all on the same page.
I love it.
Shared decision making is a very important tool that we use broadly in oncology. It's actually in between the active and passive decision making, where either the physician or the patient make decisions, so it's in between. To me, that's kind of like a situation where physicians or clinicians would recommend and advise and kind of dissect the topics and then lead the patient together to come up with the decisions about care, really for the best interest of the patients. So I think that's where we are with the shared decision making.
Got it. So shared decision making is when you, as a patient or a caregiver, meaningfully discuss your diagnosis and your treatment plan.
Ideally working towards something that's personalized to your comfort level and to your needs. Shared decision-making helps the patient to feel empowered to bring in their own research, to bring perspectives on treatment to their doctor, and to ask questions if they don't agree with their healthcare provider.
I'm curious, does Cheri have the same definition?
I would say that shared decision making is a collaboration between a patient and his or her providers with the goal of making decisions that are the best ones for the patient. I think it involves considering many factors such as age, other diagnoses, and treatment goals when coming up with the best plan of care.
It's the connection between the involved parties in this level, the clinician and the patient, or the patient closest relative, that could really describe and lead the treatment decisions in terms of what will be the next for the patient to do, what will be the next to look forward. It's really the individualized care that every patient deserves, and that at least we approach our patients this way.
I'm anticipating one of the challenges that might pop up when it comes to shared decision making.
What's that?
I feel like patient education is super important. To make a good decision, you need to be informed.
It's one of the hardest decisions that we have, because we have to educate our patients in a language they could understand. We have to kind of all stay on the same language, and then they feel that they have enough information and they are kind of comfortable enough to wait in and share their part for the decisions. I think it's a very important in diseases that people live with for long, because they actually know more than 50% of what's been going on. They know actually almost everything. I'm just like watching it and trying to figure out and navigate, and then really recommend and advise how do we come to the best for them.
That makes sense. I would imagine education is critical here.
Of course, that's not to say that getting educated about a rare disease of any kind is easy.
Oh, absolutely not. And I've been so impressed with our guests over the last 2 seasons. Educating yourself about PV, teaching yourself all the terms, and staying up to date on new research is kind of like a second job. It's really cool to hear from Dr. Masarova that a lot of her patients are well informed too. Way to go, guys. I think I know the answer, but does Cheri educate herself between appointments?
Taking time between office visits to learn of new studies may lead to some concerns or questions you may want to run by your doctor at the next visit. I think that it allows you to keep up to date on the most current PV information, helps you to better advocate for yourself, and allows you to remain an active member in the shared decision making between you and your healthcare team.
Okay, so now I'm wondering whether that's common in the PV space.
For my patients, it's very common. That's because it's encouraged and that's how we function. But I do kind of hear and know that it's not very common in general. And partly because, again, the disease is more rare. But my patients would come and really be engaged and advocate, which makes the visits not easier, but more focused.
Before we go deeper into shared decision-making, I want to talk more about why it's so important.
Good point. A lot of people view doctor's appointments as times where the doctor advises and you listen.
Shared decision-making is important because your perspective, your questions, and your needs matter.
Shared decision-making is really empowering to the patient or the caregiver of the patient.
Exactly. And when a patient feels empowered, they are more likely to bring their own research, ask questions, and have engaged conversations about treatment options.
The importance of the shared decision-making is exactly the longevity and durability of the disease, and then staying on the same road, having the same goals, the same treatment opinions, the same perspectives, where we know and we have seen from even surveys or studies, these differ. Physicians or clinicians have different goals and feel differently than patients, and often we don't speak the same language.
We've talked about this in the past, like when doctors have advised some of our guests to wait and see how their PV progresses, while the patient themselves would rather take a more proactive approach.
So there, the shared decision-making is a very important way to come to the best treatment plan, and revisiting it on every visit or every appointment, because disease could evolve, and then again, both parties should wait in the needs and the goals that have to be addressed to come to a decision, what will be the best step forward?
I think it's been invaluable. My shared decision making is a part of every visit that I make to my NPN specialist. My doctor values my input and always allows me plenty of time to ask questions before any changes are made to my treatment plan. The pros and cons of each decision regarding my PV are discussed, and then we come up with the best plan of care for me. So it's made me feel that my opinions and concerns really do matter.
Also, the adjustments as the disease evolves, as people live, the goals also changed over time. And there are the discussion about, are we the same? Do we have to change? Do we have to even think about this? Really starts to weigh in and gets more on both parties, where I will be more, hey, watch out for symptoms, watch out for this, let us know. We won't see you so, but we will have to get you earlier. And I will be more alert by certain findings that I see and more prepare the patients for, well, something's coming, we may need to be making changes. But those are very important in really staying on top with diseases that people live with.
This makes a lot of sense to me. And now I'm wondering how Dr. Masarova encourages shared decision-making with her patients. Speaking for myself, I know I might be hesitant to bring up my own questions or concerns. It can be really intimidating to communicate with your doctor.
I was wondering that too, and I also wondered how comfortable Dr. Masarova's patients felt communicating with her. We asked how frequently patients came into her with proactive thoughts and questions about their treatment plans.
My patients come every visit. I actually actively encourage that. That actually is how we work. And even on the first visit, they leave the appointment and they know that they are kind of in power. I always tell them that patients are the best advocates.
The most important piece of advice I could give a newly diagnosed person would be to be your own advocate. You know yourself better than anybody else does.
Oh, we've heard this in the past. I think Steven said this last episode. You are your own best advocate. It's really nice to hear that from the doctor's perspective too. It's not just a one-sided conversation. You can and should advocate for yourself.
I cannot know what they feel. They have to tell me. And also, I don't know what other issues with the diseases come in terms of the fears, again, all kind of burdens that the disease and living with the disease brings on.
Exactly. Your doctor can't know if you're not comfortable with your treatment or which symptoms are bothering you if you don't communicate those things to them.
Quick reminder that it's important for patients to bring up all of their symptoms with their doctor.
That's why I keep bringing up the Netflix thing, Josh. You have to know how I feel.
I am well aware.
So my patients would come prepared and actually get me all kind of opinions and decision making that are important for our co-management, which I am very passionate about and very much support. So then both of us feel good and listened to, that the concerns I've had were addressed, as well as, and more importantly, as patients concerned were listened to and addressed. We don't have miracles that we can address everything and get everything perfect, 100% disappear, but we should at least listen and address everything that's been going on and at least acknowledge where the limitations are. So I, as a physician, could keep on working and moving the field forward, and patients could feel empowered to discuss, engage, and listen and communicate either together in between themselves or also with us and within different NPN patient power organizations to bring up what is actually the hot topic that nobody addresses. What are the unmet needs that all of us have to focus? Sometimes it's from my view, sometimes it's from patients' view, but it always serves the same purpose. How do we make patients' lives better? How do we address what's not addressed? And even if we may not be there right now, we should acknowledge that this is how we need to move forward, and these are the goals we need to focus on and make our priorities to improve upon this disease.
It sounds like Dr. Masarova is really taking her patients' needs and emotions into consideration, and I love that. If I were trying to make my own treatment plan, I would want a doctor just like her. You want your fears to be listened to and understood. You do not want to hear, don't worry about it, it's the good cancer, yada, 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 yada.
This conversation with Dr. Masarova also really goes to show that if you're being dismissed, if you do feel like your concerns aren't being listened to, you can find a different physician better suited to your needs.
True. Did Dr. Masarova have anything to say about finding the right doctor for yourself? That's a really important element to shared decision-making.
I think for diseases that people live for a very long with, it's very, very important. It is really the mutual trust that is built up quite difficult, but quite hard, and that needs to be really a solid rock within the relationship. If we're talking about shared decision making, we need to really be both sides on the same goals and both sides of the same coin to talk about the same things. And it doesn't go without the knowledge of one or the other goals or perspectives or priorities. So it is very needed in these kind of diseases where sudden change in a disease could happen without warnings. It's not common, but might. And not being aware that something is really wrong or something is really needed, and then suffer, I don't really see that as any fit in anything. And it's especially more important for patients, again, that carry the burden and the quality of life impact of a chronic disease.
So we've talked about how important it is for the doctor to be a good fit for you and for the doctor to listen to your needs and concerns. I'm wondering if Dr. Masarova has any advice for the patient side of shared decision making.
Great question. We asked Dr. Masarova what advice she'd give to patients who want to get a little more involved in making decisions regarding their PV.
I would suggest and patients nowadays, to really listen to what they want, to set their goals, to connect maybe with the community, with different peers within the social groups, with patient powers organizations, advocates organizations, to explore how others either approach the disease or what the options look like, raise the concerns, talk, and if, for example, unfortunately, sometimes they don't really get the feedback.
We've always talked about the importance of community on this podcast, but we haven't talked about it from this angle before.
Right. So much of shared decision-making involves self-education, and so much of self-education involves reaching out to your community.
And Facebook.
Obviously.
I think it's sometimes really hard to find your voice when you feel like you've lost a part of yourself and a part of your health. Which is exactly how I felt upon my diagnosis. So I found great help in social media support groups. Once I was a part of a larger group of people with PV, I didn't feel so alone. And chatting with others gave me ideas on what questions might be most beneficial for me to ask of my healthcare team, especially when I was newly diagnosed. I think that advocacy support groups are beneficial as well and can help teach you how to be better informed and communicate effectively. And I think most of all, you need to remember that your voice matters and nobody knows you like you.
The second part, where the clinicians are not so well experienced in the disease, then seek second opinion. Even ask around, see who could be a better fit for me, who could at least advise me, even though they may not transfer the care to that particular provider because that specific person lives across the whole United States or even different country, but at least get the connection established and at least get educated on what are the important either goals or milestones that should not be overlooked and people should connect with.
Kind of like what we said a few minutes ago.
And what we've reiterated on previous episodes.
Seek a second opinion if your first doctor doesn't feel like a right fit for you.
It's nice to hear this advice coming from a physician.
I have another question for Dr. Masarova.
Shoot.
Something we talk about a lot in the rare disease space is how patients often minimize their own discomfort during their doctor's appointments. They just say, I'm fine, to get through the appointment, to be less of a burden, or for whatever reason. This would obviously have an impact on how effectively the patient and the doctor can make a shared decision. Does Dr. Masarova talk about that at all? How does she navigate conversations like that?
That's a very typical question and very typical point for patients with Polycythemia Vera or generally MPNs. We have a validated scores to assess the symptoms that should be used at every visit, and people should be aware, like, we really have a validated uniform tool to assess how people feel. They've been developed across the studies specifically for people with PV or MPN in general that assess different symptoms. But even though these ones are still subjective and they still have limitations, people say, well, I have fatigue. Well, some people would respond, I have fatigue too. What do you want? And I heard that a lot. So that I don't think it's any appropriate in anybody helping. And then I'm fine. I have nothing happening. It's very common. I think what I always emphasize and always say is asking what has changed. in a reasonable time, which I usually put in 3 to 6 months. So either from the last visit or describe me what has changed in the 6 months. How is life? How things are changing? Do you have any limitations? That will describe me the I am fine more than anything could, even any questionnaires.
Essentially, Dr. Masarova is turning those subjective questions, like, how are you feeling, for example, into more quantifiable ones that can't be hidden behind, I'm fine.
I tell them, journal, put down the concerns, put down how you feel, see whether that has a specific pattern, see whether we can understand you wake up tired or you become tired at the end of the day, you're just tired regardless, how tired it is. Could you carry a milk or no? So those kind of things that we go more in depth, and even when we see the repeated questionnaires that don't change, but people are definitely crashing, then I think it's not only the fatigue, it's the score where I really go, okay, look back and tell me 6 months and compare this to now. That I think it's the most important for the assessments.
Got it. And this is helpful for people living with PV too. Tracking your symptoms over time gives you a clearer idea of how you're doing now.
Right. It's easier to describe your symptoms and their severity when it's relative to something else. Are you feeling tired is harder to answer than, are you feeling more or less tired since the last time we spoke? This is crucial to an effective shared decision-making process.
Now, from a patient perspective, what if your doctor isn't asking you questions this specific in your appointment?
Good question, Josh. As a patient, or a caregiver to a patient, you can ask these specific questions of yourself or whoever you're caring for and bring that information to your doctor. It'll still be very helpful.
Before we wrap up, does Dr. Masarova or Cheri have any final advice for people living with PV?
The patient is the best advocate. So get engaged, try to learn, use the resources, they are valuable. Communicate. If you don't have the feedback, try to see whether there is some experts that would know something and could help.
Keep learning while also getting your information from legitimate sources like Mayo Clinic or National Institutes of Health. A simple Google search on PV is probably not going to pull up the most recent or even the most accurate information. And there's a lot of scary stuff out there that was, a lot has changed since my diagnosis even.
Once again, the importance of education.
It bears repeating. It's so important to learn as much as you can about your diagnosis.
At the same time, don't get too fixated because it's unfortunately a disease we cannot cure. We try our best to eliminate, mitigate, decrease all possibilities and all symptoms and burdens disease comes with, but we don't have the miracles yet. And listen to your body and communicate the message.
I'd also encourage those newly diagnosed to make sure not to forget about your mental health. It's really difficult living with a chronic illness for which there is no cure. So maybe take up a new hobby or learn mindfulness and meditation, or just simply allow a certain amount of time each day to reflect on you, your personal journey, and how you can make the best life for yourself, both mentally and physically.
Kay, what a fantastic episode.
I know. It's been so helpful to have both perspectives, patient and physician, especially for a collaborative topic like shared decision-making. Thank you so much for joining us today, Cheri.
And thank you, Dr. Masarova, for joining us today on the podcast and for your insight on shared decision-making. This was a really illuminating episode.
And thank you, listeners, for tuning in.
This has been the PV Pod, Stories from the Marrow, a podcast about Polycythemia Vera.
We'll see you next time. The PV Pod, Stories from the Marrow, is produced by Believe Limited and Bloodstream Media, and made possible thanks to our sponsor, Pharma Essentia. The PV Pod is hosted by me, Kay Vermeil, and my co-host, Josh Bragg. If you like the show, please share it with anyone for whom it might make a difference, and leave us a rating on Apple Podcasts or Spotify. We'll see you next time.